In any city, just like this one on Australia's south coast, people go about their lives making choices that can affect their health, their family, and the community. Most of the time, they're not even aware of those choices or their associated risks. And that's where you and the ASSIST program come in. Hi, I'm John Marsden. I'm one of the co-developers of the Alcohol, Smoking and Substance Involvement Screening Test developed for the World Health Organization, which assesses the risks associated with drug and alcohol use. We found that when people become more aware of the impact their decisions are making for their health, they become much more likely to change their behavior and improve the quality of their life. So I'm thrilled to be part of this program made by nurses for nurses. And I'm going to be showing you how in just 10 to 15 minutes you can make a positive impact on someone's life simply by using the ASSIST and delivering a linked brief intervention. So let's see how it works. Mel is your average 30-year-old. She's ambitious, enjoys travelling,
here you go, girls.
and likes a few drinks with her friends.
Sauvignon Blanc this time.
That's fun. So you must be getting ready to go overseas soon.
Yep, only just over 3 weeks.
3 weeks?
Yes.
Wow. Are you ready?
I'm not ready at all.
You'll be right.
So where exactly are you going?
I'm just going to Vietnam, so I'm starting off in Hanoi, and then that little place where you get your suits made really cheap.
So overseas, do you have to have shots or do you just take a tablet and that's it?
No, you do need to get some vaccinations.
You can tell she doesn't get out much.
Yeah, no, I'm going to see my doctor on Monday and he'll sort it all out for me then. So.
Oh well, cheers to going overseas.
Mel enjoys the night with the girls and a few days later goes to her general practitioner in preparation for her trip.
Hi, Melanie Cooper. I'm here to see Dr. Harlan. Sorry I'm late.
That's all right, Melanie. The doctor's a bit late as well, so have a seat.
Thank you.
It's a routine visit to get vaccinations before going on holiday. What Mel doesn't know is that she's about to get a clear, focused look at her current lifestyle choices.
Mel, let's come through.
Thank you.
Having seen her doctor, Mel's receiving her vaccinations from the practice nurse.
Mel, the doctors in the practice, they like you to wait 15 minutes so I can observe you for any possible reaction.
Okay.
And while we're waiting, would you be interested in doing a lifestyle survey?
What would that involve?
Yeah, it's a simple questionnaire, 8 questions.
Okay.
Yeah, well, let's get started. Would you like to take a seat?
Thank you.
Okay. Okay, Mel, I've got a response card so you can follow the questions with me as we go through them. So,
Okay.
I mean, the questions are really about your experience of using alcohol and tobacco products and other drugs across your lifetime, but particularly during the last 3 months. We're interested in knowing about your use of illicit drugs, but please be assured that this is a confidential survey and will be treated as such.
Okay.
So your responses are held in strict confidence.
Okay, good.
Great. So again, there's 8 questions, and we'll just go through them one at a time and follow your response card.
Okay.
Okay, the first question is, in your life, which of the following substances have you ever used? Tobacco products?
Yes.
Okay. Alcoholic beverages?
Yes.
Okay. Cannabis?
No.
Cocaine?
No.
Amphetamines, stimulants such as speed, methamphetamine,
No.
ecstasy?
No, nothing like
Okay,
that.
great. Inhalants, that would be petrol or paint thinner, so...
No.
Okay. Sedatives or sleeping pills?
No.
Hallucinogens such as LSD or acid, mushrooms, trips?
No.
Okay. What about opioids? That includes the heroin and the morphine range of drugs?
No, nothing.
Okay. And anything else?
No.
Okay, great. Okay, we're on to question 2.
Okay.
Okay. In the past 3 months, how often have you used the substance that you mentioned? The first one would be tobacco products. And is that cigarettes?
Yeah, cigarettes. Never in the last 3 months. I quit about 6 months ago.
Okay, that's wonderful. Great. Oh, and what about alcohol?
We go out for drinks on the weekends, so well, sometimes it's a Thursday and a Sunday as well, so it's weekly.
Okay. Question number 3. During the past 3 months, how often have you had a strong desire or an urge to drink alcohol?
I wouldn't say it's an urge. Just something I like to do, but yeah, not a strong desire. So never.
Okay, thank you. We're on to question 4. We're halfway through the questionnaire.
Okay.
So, During the past 3 months, how often has your use of alcohol led to health, social, legal or financial problems?
Well, health problems, I suppose you count the hangovers in that. I do get some pretty bad hangovers sometimes and some bad headaches. So
Okay.
probably, yeah, it's a few times in the month, so probably monthly.
Okay. Question number 5. During the past 3 months, how often have you failed to do what was normally expected of you because of your drinking, because of your use of alcohol?
Well, my boss has learnt never to schedule a meeting before 10 o'clock on a Friday morning, so
Okay.
yeah, I used to miss a few meetings, so I'd probably say monthly. It's a few times the last month I haven't been able to get into work at all because of a hangover.
Okay,
so.
thank you, Mel. Thank you for telling me that. Okay, question number 6 is, has a friend or relative or anyone close to you ever expressed concern about your use of tobacco?
Yes, but not in the past 3 months.
Great. And what about alcohol? What about your alcohol consumption?
Yes, my boss pulled me up just the other week and he was a bit concerned about, I'd obviously had a big night and I was missing work every so often. So
Okay. Anybody else express concern to you?
yeah, a few of my colleagues have had a few words.
Okay, Mel, question number 7. Have you ever tried to cut down on using tobacco products but failed?
Yes, but not in the past 3 months.
Okay, because you gave up some time
Yeah,
ago
quit 6
and you've
months
not
ago.
used since?
No.
Wonderful, that's great. Okay. Have you ever tried to cut down on using alcohol but failed?
No, never. I've never seen the need to cut down.
Okay, and we've got one final question, and I think you've largely already answered this. Have you ever used any drug by injection?
No.
Okay, that's great. Okay, that completes the survey, all 8 questions. Just give me a moment to tally up the results, and then we just need a minute or two to discuss that, and then I think it'll be time for you to go.
All right, sure.
All right, great.
The assist questionnaire has only taken a few minutes. Now, Mel is curious to see what happens next. From the nurse's perspective, screening for drug and alcohol misuse is a great start. But the real difference is made by providing a targeted brief intervention. The assist gives a score related to the person's risk of related harm. That score can be low, moderate, or high. Let's see how Mel scored.
Okay, thanks for waiting, Mel. That's
No
great.
worries.
Would you like to see the results?
Okay.
Okay, the good news is that you're in a low risk group for just about everything on the page that you can see there. And but you are in a moderate risk group for your use of tobacco, and you are in a moderate risk group for your drinking. And but you did give up some time ago. You did give up smoking, didn't you?
Yeah, 6 months, yeah.
That's great, wonderful. So it's really alcohol that we're concerned about today.
So what does that actually mean?
Well, Mel, if you look here, you're at moderate risk of these conditions. So we'll just go through them together. Hangovers, accidents and injury, premature aging, digestive problems such as ulcers or inflammation of the pancreas, indigestion, anxiety and depression, financial and work problems, difficulty remembering things or solving problems. And there are some quite severe consequences such as stroke and permanent brain injury.
Right. Oh.
Can you relate to any of these, Mel?
Definitely the hangovers and yeah, the hangovers and headaches affecting my work. Yeah, I'm surprised I didn't realise my drinking was putting me at risk of those other things.
Okay, I'd like to ask you, what are some of the good things about your drinking?
Oh, well, it's a social thing. You go out for a few drinks after work with the girls, and it makes you feel good. It's relaxing.
Okay, so what are some of the less good things then?
Hangovers are terrible sometimes. The headaches and yeah, sometimes loss of concentration at work. And things.
Okay, so if the good things are associated with your time with your friends and socialising, the less good things are actually associated with some of the risk factors that we've talked about.
Yeah.
And yeah, is there anything in particular that concerns you?
I have been concerned about how the hangovers have been affecting my work. And,
Okay.
Yeah.
So what's most important to you at the moment?
My career is very important to me. I'd hate to think that my drinking was going to affect how I do my job.
Okay, so you're ambitious?
Yeah,
Your work's important
take it
to you?
seriously, yeah.
Okay, so Mel, for that reason, would you consider cutting back? Or perhaps even stopping your drinking for a while?
I couldn't imagine not drinking at all, but I could certainly consider cutting back.
Okay, that's good. Mel, ultimately the choice is yours, but there's some information that might help. Are you aware of the low-risk drinking guidelines?
No.
Okay. So the guidelines suggest no more than 2 standard drinks a day and no more than 4 standard drinks on any one occasion. And an occasion would be a night out with the girls.
Okay.
So Mel, do you understand what a standard drink is?
No.
Okay. Well, Mel, on the wall there's a poster and a picture of a wine glass, and it's about half full. And that's 100 mils, which is considered a standard drink of wine. And you can see on this plastic beer mug that 100 mils comes to about there.
Right, okay. Yeah, no, when I have a glass of wine, I'd have a full glass, so I've probably been drinking a lot more than I realised.
Okay, well, Mel, if cutting back is something that you're thinking about, the Reduce Your Risk brochure is very helpful, and it's got some really good information. You can see it's not too complicated, and it, what do I need to know? What do the guidelines recommend? What are the health risks? And we've discussed some of those health risks, and you've identified some of those. And what is a standard drink? So you know what a standard drink is now, and I think you might be a little more aware of some of your possible health risks.
Yeah. Okay, yeah.
Why don't you take that brochure?
Yep, okay.
And one of the tips is to, when you go out for a night with the girls, to have a plan about what you intend to drink. Maybe keep count of what you drink, and alternating a glass of wine with a glass of water. Is that something that you'd consider?
Yeah, certainly.
Okay, that's great. Wonderful. Okay, so please take the brochure.
Yeah.
And do you have any questions?
No, but you've given me a lot to think about.
That's great.
So Mel's okay to leave, and we'll find out shortly if that brief intervention has made any difference to her behaviour. A key to the assist being effective is that the brief intervention is matched to the person's stage of change. But what do we mean by that?
The stage of change model developed by Prochaska and DiClemente provides a useful framework for understanding the process of behaviour change. And this is important when we consider how ready somebody is to make alterations to their substance use. The assist-linked brief intervention aims to help people as they move through one or more changes. So let's take a closer look at Mel's journey in relation to this model.
We could see that Mel was in the pre-contemplation stage when she was out happily drinking with her friends. Many people who are seen in the primary care setting are likely to be in this stage. In Mel's case, we saw the nurse focus on raising Mel's awareness of the risks related to her current pattern of consumption.
Anxiety and depression, financial and work problems, difficulty remembering things or solving problems.
Mel started thinking about her alcohol use when asked to explore the good and less good things about her drinking.
Oh, well, it's a social thing. You go out for a few drinks after work with the girls, and it makes you feel good. It's relaxing.
Okay, so what are some of the less good things then?
Hangovers are terrible sometimes, the headaches.
The nurse reflected on the issues raised by Mel and provided brief advice and take-home information.
Why don't we just start with the definition?
But has it made any difference? Let's check in on Mel 1 week later.
Nothing wrong with that.
How did your shots go?
Fine, it ached for a little while, but it's fine now.
That's good.
Oh, that's enough for me, thanks.
Why?
Oh, I've got that early morning meeting. I don't want to have a big night.
It's not very much.
It's about 1 standard drink.
Are you pregnant?
No. Just when I went to see the nurse, he was saying that actually 1 standard drink is only 100 mils of wine. So you guys have got about 2 or 3 standard drinks there.
So? Okay.
Just want to be careful. Anyway.
Right. So what's happening with Scott while you're away?
Mel had obviously done some preparation before she went out this time, as she'd planned to limit her alcohol intake.
Oh, that's enough for me, thanks.
We could see Mel was actively doing something about changing when she told her friends she didn't want to have a big night.
Mel has put her decision to cut back into action. This can be a difficult time for people, and encouragement and support will help to maintain their decision. So this is a great start, and time will tell whether Mel will keep up the change. There is always the possibility of a relapse back to old behaviour.
The key to avoiding relapse is to identify high-risk situations and have strategies for managing them. A lapse is a normal part of behaviour change. The key is to recognise it early and get back on track. Now let's turn our attention to Ben, a university student with a lot going on in his life.
As you'll see, the assist also records the risks that are associated with illicit drug use. These risks might otherwise go undetected until a person is experiencing serious harm. Right now, Ben is attending a lecture.
Ben is in the 4th year of a 3-year business degree. He's struggling to keep up with the workload and has failed a couple of final year subjects. His nagging cough isn't making him too popular with his fellow students, and he's clearly struggling to concentrate on the lecture. Concerned about his cough, Ben visits the University Medical Centre.
Thanks for that. If you want to take a seat, we won't be long.
Cheers. Hey, I was wondering if I could see a doctor.
Did you have an appointment?
No.
I'll have to check with doctor. Can we fit one more in this afternoon?
Have you been here before?
Yeah, a few years ago.
Oh, if he doesn't mind waiting, let's make that the last one for today.
Okay. Are you okay to wait?
Yeah, sure.
Okay. What was your name?
Ben Curtis.
Okay, Ben. So while you're waiting, would you mind filling out a short questionnaire?
What is it?
It's called the assistant. It only takes 5 to 10 minutes to complete.
Yeah, okay.
Great. Okay. So the instructions are on the screen. So if you just want to take a seat, fill it out and bring it back up once you're done. Thanks.
Whether it's on paper or screen, people can answer the assist while waiting for an appointment. Once he's finished, Ben will be invited to speak with the nurse about his scores.
Just take a seat in here for me, Ben.
Thanks.
Ben, my name's Louise. I'm the practice nurse. Thank you for coming today. Look, we've got a few moments before the doctor comes in to see you, so I appreciate the fact that you've actually completed the questionnaire, and I'm wondering if you're happy to go through the results.
They were confidential, weren't they?
Absolutely, yeah, they're definitely confidential.
Oh,
yeah.
okay.
Certainly all the information stays here in the practice, so don't worry about that.
Okay.
Okay, so are you happy for us to go through the results now?
Yeah.
Okay, all right. So I just want to draw your attention to the questionnaire, and as you'll see here, you've basically scored low-level risk for most of the substances, which is great. That's really good. Well done. But with the exception of 2, and that's cannabis and tobacco.
Yeah, I kind of guess that.
Okay, so expected?
Yeah. That list, it's all confidential, right?
Absolutely.
Yeah.
Yeah.
Okay.
As I said, look, rest assured, it's confidential. This is about just giving you some information and perhaps seeing, in what way I might be able to, to support you or to assist you.
Right. Okay.
Yeah. So, what does the scores actually mean? In terms of your cannabis use, do you mind if we talk about your cannabis use?
Yeah, it's okay.
You're okay with that?
Yeah.
Okay, all right, great. So going by the screen results, what it actually says is that the pattern that you're using, the cannabis, it can actually potentially cause you harm, if not already. So you're actually in the moderate risk of harm. So people who use cannabis regularly, the problems that are associated with the use, and you may already be familiar with this, are things like problems with attention and motivation. As you can see there, anxiety. Sometimes people experience panic. They may experience depression. Yeah. Things like asthma and bronchitis. I'm just wondering if any of these are a concern for you?
Well, I came into the doctor to check out this cough, so I guess that might be the cause of it.
Okay, so you think cannabis is related? That's related to cannabis?
Yeah, probably. Yeah.
Yeah. Okay then. So it seems to be bothering you, that cough.
Yeah, I've had it for a while now.
Yeah. Okay. So tell me, Ben, what do you think the good things are about you using cannabis?
I guess it helps me to get to sleep at night. Okay. It kind of calms me down. Like when I get really stressed at uni, I'll have a puff and it'll calm me down a lot. It's kind of what we do at the house where I live.
All right. So what then would the not so good things be about smoking cannabis?
Well, I used to be really fit and play soccer a lot, but I can't run like I used to. I feel like I get out of breath very quickly, and it's kind of interfering with uni. Like I've had to repeat a year and do 2 more subjects.
Okay. So what you're saying is basically, on one hand, smoking cannabis relaxes you, it calms you down, and it helps you sleep. And on the other hand, it seems to be having a negative impact on your fitness, and you're actually failing at university. Would that be right?
Yeah, that's right.
So what's most important to you then, Ben?
I guess I just really want to get home, see my family. I haven't been home in a while.
Okay.
And yeah, see my family or friends.
Okay. And why is that?
Well, my parents don't know about the pot, so kind of a bit anxious to tell them. And my friends back at home don't smoke it, so they kind of pay me out for it, which is a little bit embarrassing.
Yeah, okay. So have you ever put any thought into perhaps cutting back or stopping your cannabis use?
No, I've never thought about it.
No? So looking at these results, what do you think perhaps